Thumb pain might seem like a small issue, but if you've ever experienced it, you know how much it can disrupt your daily life. Thumb pain refers to discomfort or soreness that occurs in any part of your thumb, from the tip to where it connects with your wrist. Your thumb is a very unique finger because it can move in ways other fingers can't. This makes it incredibly useful, but also more prone to injury and overuse. It is also quite complex, containing multiple joints, tendons, ligaments, and muscles that all work together to help you grip, pinch, and manipulate objects. When any of these structures becomes injured or inflamed, you can experience pain that affects your daily activities in significant ways. In this video, we will dive into everything you need to know about thumb pain, from its causes and symptoms to its diagnosis and effective treatments. So, without any further ado, let's get started. Causes of thumb pain. Thumb pain can be caused by a wide range of factors, from everyday activities to underlying medical conditions. Here are the most common causes. Number 1. Arthritis. Arthritis is one of the most common causes of thumb pain, especially in older adults. There are two main types of arthritis that affect the thumb. The first is osteoarthritis, which happens when the cartilage in the thumb joint wears down over time. This cartilage acts as a cushion between the bones, and when it deteriorates, the bones start rubbing against each other, causing pain, stiffness, and swelling. The basal joint, located at the base of the thumb, is particularly prone to osteoarthritis. The second type is rheumatoid arthritis, which is an autoimmune condition where the body's immune system mistakenly attacks the joints, leading to inflammation, pain, and sometimes deformity. Rheumatoid arthritis often affects multiple joints, including the thumb. Number 2. Overuse or repetitive strain. Repetitive activities that involve gripping, pinching, or twisting motions can put a lot of strain on the thumb's tendons and muscles. For example, if you spend hours texting, gaming, or typing on a keyboard, you might notice your thumb starting to ache. Other activities like knitting, gardening, or playing musical instruments can also contribute to repetitive strain injuries. Number 3. De Quervain's tendinosynovitis. This is a condition where the tendons on the thumb side of the wrist become inflamed. This inflammation causes pain and swelling, especially when you move your thumb or try to grip something. This condition is particularly common in new parents who frequently lift their babies and in people who perform repetitive hand movements. Number 4. Nerve compression. Nerve-related issues can also cause thumb pain, often accompanied by tingling or numbness. The most common condition is carpal tunnel syndrome, where the median nerve in the wrist becomes compressed. This nerve runs through a narrow passageway called the carpal tunnel, and when it's compressed, it can cause pain, tingling, and weakness in the thumb and other parts of the hand. Nerve compression can be caused by repetitive hand movements, prolonged wrist flexion, or underlying conditions like diabetes or thyroid disorders. Number 5. Trigger thumb. This is a condition where the tendon that helps the thumb bend becomes inflamed and catches or locks in place. This can cause pain, stiffness, and a clicking or popping sensation when moving the thumb. Number 6. Injuries. Thumb injuries are another major cause of pain and can happen due to accidents, falls, or sports-related activities. A sprain occurs when the ligaments in the thumb are overstretched or torn, often from a fall or sudden impact. This can cause pain, swelling, and difficulty moving the thumb. A fracture, on the other hand, happens when one of the bones in the thumb breaks, leading to severe pain, swelling, and sometimes visible deformity. Dislocations occur when the bones in the thumb joint are forced out of their normal position, causing pain and instability. All these injuries often require immediate medical attention to ensure proper healing. Symptoms of thumb pain. The symptoms of thumb pain can vary depending on the underlying cause. With arthritis, you might notice pain that's worse in the morning or during cold weather, along with stiffness and reduced range of motion. The joint might feel warm to the touch and appear slightly swollen. When dealing with tendon problems like De Quervain's tendinosynovitis, you might feel pain along the thumb side of your wrist that gets worse with hand and thumb movements. There might be a gradual onset of pain that becomes more noticeable when gripping objects or turning your wrist. Trigger thumb often causes a catching or locking sensation when you try to bend your thumb. You might hear or feel a clicking sound, and your thumb might even get stuck in a bent position. In cases of nerve involvement, such as carpal tunnel syndrome, symptoms may include numbness, tingling, or a burning sensation in the thumb and nearby fingers. Finally, with injuries, the pain usually comes on suddenly and might be accompanied by visible swelling, bruising, and difficulty moving your thumb. The area might be tender to touch, and you might have trouble performing simple tasks like holding a cup or turning a doorknob. Thumb pain can also make it difficult to grip or pinch objects. You might notice that your thumb feels weaker than usual, especially when performing tasks like opening jars or holding a pen. Diagnosis of thumb pain. Diagnosing thumb pain usually starts with a physical exam. Your doctor will ask about your symptoms, medical history, and any activities that might have contributed to the pain. They'll also examine your thumb, looking for signs of swelling, tenderness, or limited range of motion. In some cases, your doctor might order imaging tests like X-rays, MRIs, or ultrasounds to get a closer look at the bones, joints, and soft tissues in your thumb. These tests can help identify conditions like arthritis, fractures, or tendon injuries. If nerve compression is suspected, your doctor might perform a nerve conduction study or electromyography to assess the function of the nerves in your hand and arm. Treatment for thumb pain. The treatment for thumb pain depends on the underlying cause, but there are some common treatment options. Number 1. Rest and activity modification. One of the simplest ways to treat thumb pain is to rest the affected thumb and avoid activities that worsen the pain. This might mean taking a break from texting, gaming, or other repetitive tasks. Your doctor might recommend using your other hand more frequently for daily tasks. Number 2. Splinting or bracing. Your doctor might recommend wearing a splint or brace to limit thumb movement and allow the affected structures to heal. The type of splint depends on your specific condition. Some splints immobilize just the thumb, while others might include part of your wrist. You might need to wear the splint continuously at first, then only during activities that aggravate your symptoms. This is especially helpful for conditions like de Quervain's tendinosynovitis or arthritis. Number 3. Ice and heat therapy. Applying ice can help reduce pain and swelling, especially in the first few days after an injury or during acute flare-ups. Try to apply ice for 15 to 20 minutes at a time, several times a day. After the initial acute phase, heat therapy can help improve blood flow and reduce stiffness. You might find that alternating between ice and heat provides the best relief. Number 4. Medications. Several types of medications can help manage thumb pain. Over-the-counter anti-inflammatory drugs like ibuprofen or naproxen can reduce pain and swelling. For more severe pain, your doctor might prescribe stronger pain medications or anti-inflammatory drugs. Topical medications, including creams or gels containing anti-inflammatory ingredients, can be also applied directly to the painful area. Number 5. Corticosteroid injections. For severe pain or inflammation that doesn't respond to other treatments, your doctor might recommend a corticosteroid injection. These injections deliver powerful anti-inflammatory medication directly to the affected area. While they can provide significant relief, the number of injections you can receive is usually limited due to potential side effects. Number 6. Physical therapy. A physical therapist can teach you specific exercises to strengthen the muscles around your thumb and improve flexibility. They might also use techniques like ultrasound or electrical stimulation to help reduce pain and promote healing. Number 7. Surgery. In cases where conservative treatments don't provide adequate relief, surgery might be recommended. The type of surgery depends on the underlying problem. For arthritis at the base of the thumb, joint reconstruction or replacement might be necessary. Trigger thumb might require a simple procedure to release the constricted tendon sheath. Recovery time varies depending on the procedure, but usually involves a period of immobilization followed by physical therapy. At the end, with the right treatment and a few lifestyle adjustments, you can get back to using your thumb pain-free. If your pain persists or worsens, don't hesitate to see a doctor. Your thumb is too important to ignore. Now, we want to hear from you. Have you ever experienced thumb pain? What do you think caused it, and how did you manage to relieve it? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.